we have done by means of two machines, localization alpha 10. These are the models, and both the machines were imported from Japan. This is the only doctor who imported that ultrasound machine for fetal scanning from Japan in India first. Okay, Dr. Suresh. You only give an idea to me to start to focus on that one. Okay, but still the doctor of product. Once that certain product is keeping that one, he wants a detailed backs to that one is what's the age of a patient, what the thickness of that patient. Okay, within that 5 to 10 minutes he need of these details. Okay, if it is abnormal, what kind of disease he might possess. Okay, and if it is so aging, what kind of such a product he need from us. Okay. And another machine, namely Philips ultrasound machine. Actually, this machine gives more resoluted information as compared to this localization alpha 10 machine. And here for this work, both the longitudinal image and transversal image in B mode has been done. But this recording is done only for 2 centimeter before the bifurcation of that common carotid artery, not an entire part of the things to maintain that one. And blood pressure is parallelly have to check. And here we won't consider what happens with the blood pressure and other kind of signal pros which are kept in that radial or other arterial one in that one. Okay, there also you have to look into control what are the other parameters or other component which are introduced while you are taking that scanning component. Next. So these are the inputs which I already shown that movie in the previous slides. So this is a sample of an image which shows the transversal view of common carotid artery. You see that one. This near wall that there is no information. When there is a far wall, as per our naked eye, it shows some intensity variations as compared to this lumen and other tissue levels. Okay. So it is recorded for 2 to 3 cardiac cycles. Next. And this is in video slide and stored as for 20 to 30 frames for this longitudinal way. Okay. Next. And this is very important, that identification of ROI. Okay, you have to insist your machine to locate where their intima, up to what extent it has to prolong, up to adventure level we have to prolong that one. Okay, have to start for each and every pixel. For each and every pixel, I have to determine that adventitia and lumen layers with the help of that image profile component which are present in that one. If suppose it's very clear that one, if the pixel value is very low, it was somewhat near to your lumen. Okay, lumen is while viewing that one, lumen has complete black intensity. What's the value of your black? 0. The maximum is 1. You can represent as in a gray level as 255. Could you able to understand? So if it is low, you can call it as lumen layer pixels. You can end that one. If not, if it is high, you can keep it as. Likewise, you have to give an data for a machine to locate your intima and an extent of your adventitia. Next. So this is an indication of a simple sample of that image profile. See that when the lumen has an pixel intensity of 20, the intima has a next maximum intensity of nearby 100 and adventitia as nearby. So you can keep as in for loop comment in this way. If so and so pixel which is having more than that, okay, you keep that as an media, intima and adventitia with the help of this profile component. Next. So the pre-processing has been done by image normalization, filtering and localization for dynamic programming procedure. Image initialization procedure and speckle reduction has been done for active contour segmentation. Next. What's image normalization? That simple histogram, okay, contrast information has been done, equalization has been done. There I had determined where that frequent repetition of that 0 and 1s to locate the pixels for intima and adventitia. Then average intensity histogram, because I am not working with a small 3x3 portion of in frame. Entire frame I have to keep scan from this extreme and to up to that end. Okay, so averaging intensity how to do further. Then what kind of filtering smoother? You all know that one, whenever you're processing some information in medical image, while keeping your contour, you will need of sharp details. Okay, while you're keeping or working with the texture or smooth informations, you will need of average filters. Okay, that's why smoothing filter is used here. Here, two-dimensional median filter has been used. Okay, there are n number of filters under smoothing. Low pass filter, okay, mean, median, alpha, trimmed, full filters are there. What actually a median? You consider some sequence of information. If you find an mid value of it, that is your median. Okay, these 3x3 square filter have been scanned from this left extreme end of your go to that longitudinal section. Previous. Stop. See here. So that 3x3 filtering has been started from this extreme end to up to this. Okay, and in what way that vertical pixel value have to start at from this lower lumen to one maxima adventitia up to this profile value of that intensity. Clear? So that filtering has been done for each and every pixel from this band up to this band how to proceed. Then only you can average it, you can locate where actually that wanted portion. Next. Yes. And it itself removes speckles and preserves edges. If you keep filtering, what actually filtering that in smoothing? You are averaging that content. Keep adding and replace that center pixel value with that average content. Here that 2D median filter of 3x3 square values have been taken from that one. Okay. Next, after filtering, you need to give a location of an visual interfaces for that horizontal starting position identified or where. And this filter really supported me to take this one. 5x5 plus sign shaped median filter. What's that 5x5 plus sign shaped filter? What's your plus sign? The filter nature is so for 3x3 median, you can consider this mask in this way. Okay. So as based upon the intensity profile, you can fix it. What's that plus 5x5? Clear? You keep this median filter likewise starting from that longitudinal, you keep adding that one. What you can get? You can get this where to start, where to end, and that intermediate intima as in a brand way. Okay, from that left extreme end to one right extreme, you have to keep add and average it at that final. Next. Okay, for this active contour segmentation procedure, image initialization procedure has been done as in differ way as what it did in that dynamic programming. Here, upper left vertex and lower right vertex has been chosen. Go to that picture. See here. So that upper left and lower right, up to what extent you have to proceed. Whereas in that earlier algorithm, by means of keeping this filtering component, keep averaging and segmentation has been done. Whereas in that active contour, vertex has been fixed from this band to this band, procedure has been followed. Okay, next. Yes. So upper vertex and lower vertex has been fixed. Then model the noise. This is a speckle reduction procedure is there. It itself is in separate very big algorithm. Speckle reduction and isotropic diffusion. Yesterday madam has given certain details about gradient operators. Okay, wherever you in need of image sharpening, you need to know where there is a sudden change in your intensity level. Okay, how you are getting in sudden changes in your time domain information? If you are taking differentiation, okay, dx by dt means where? What? The rate at which changes happen in that one. For each and every pixel you have to determine that dx1 by dt, dx2 by dt as a sequence for left to right information you have to find. Okay, there it enhances the edges by inhibiting diffusion across the edges and allowing diffusion on either side of the edge. Okay, and after that PD is performed, that is speckle reduction and isotropic diffusion is done. Then partial differential equation has been used to preserve that edges, to remove that others in that one. Okay. So conventional anisotropic defense method in terms of smoothing uniform regions and preserving edges and features has been done.